Hi, this is Robert Cahoon, Director of International Campaigns for 40 Days for Life, and I am really blessed today to be with Kevin Duffy, who has an incredible personal story as a former abortion worker in the United Kingdom. It's quite rare to have a testimony from a former senior executive for Mary Stopes, and Kevin has a fascinating story, but also a perspective on 40 Days for Life from the abortion side for our leaders as well. So, Kevin, how are you today?
Well, I'm feeling great, and thanks for the invite to come here today, Robert.
And you were stunning on our podcast. You were on interview on our podcast just several weeks back, and did a fantastic job on the podcast. And it's just, I mean, for somebody who hasn't heard your story, it'd be great to hear, your personal journey and your personal story of how where you are today, and your history and story. Yeah.
Right, very good. Well, I'll stick to the bit, obviously, that's perhaps of most interest to people watching. I had the opportunity to work in Africa after maybe 25 years working in UK financial services. Off I went to Uganda, and I was helping to lead a small private hospital group in Uganda. And over those years, in the last couple of those years, I came across Mary Stopes, who were operating in the country, and had a little bit of engagement with them on healthcare services. And so, as I planned really to come back to the UK, one of my friends in the country said, "Look, why don't you make contact with Mary Stopes when you get to London, because they're always on the outlook for people like you." And that's what I did, which started me, in a role with the organisation Mary Stopes International. I worked for 4 years as one of their directors, and then continued to do that for about 2 years as a consultant. And during that time, I visited maybe 15 or 16 of their country programmes, and I had largely had responsibility for the strategic and business development of their clinics globally, not necessarily in the UK, but more so across Africa and South Asia in particular.
So you were a senior member of staff for them. You were like a senior executive for Mary Stopes and high up in the organisation, and then travelling to 15, 16 countries across Africa and responsible for that whole entire region.
Yeah, I was a senior manager. I mean, I was global director for the clinics network. I mean, they had a different different name for that role, but that's what it was. And I was reporting directly into a board member, an international board member. And so I had the responsibility for developing, look, if we've got, I mean, at that time we had 550 clinics in 37 countries. And it was like, well, what's the purpose of the clinics? How can we make them better in terms of having more impact, is the way Mary Stopes talks about what they do, and to make them more sustainable, financially sustainable. Where can we, to make sure that these things go on, forever, as it were. So looking at it very much as a business, and looking at the source of our funding, whether it be for donors or from the women themselves, looking at the range of services that we were providing, and talking a lot about our core services, which for Mary Stopes, core services are, of course, abortion and family planning, contraception.
From your perspective, it was really safe abortions, it was a business, and you were sort of avoiding unsafe abortions in Africa. What was your understanding, what was your perspective on Mary Stopes at the time?
Yeah, I mean, that's an excellent question. I mean, it's something we've talked about, and something I've thought a lot about in the last couple of years after coming out. I think that harm reduction was the strategy that we were following. And, I come from, working in a public health background. I had looked at harm reduction in the case of, for example, how we treat HIV and how we provide medication and stuff like that. And so their approach to abortion was very much that women are going to have abortions anyway, and they're having them in the back streets, and they're dying as a result of that. And therefore, it would be better for a woman who's abortion-minded to have that in a clinic where it's safe and clean and effective.
And how did that narrative sort of break down for you, and kind of where were the kind of chinks in the thinking of like, hang on, this isn't the whole story?
Yeah, and as I said, I'd met them in Uganda, and in Uganda, Marie Stopes actually presented themselves as part of the healthcare sector, as it were. They were quite a large provider of primary healthcare services, and necessary in that. And that's what I thought they were. I thought they did a mix of things. I knew they did abortions, and they were very heavily leaning towards reproductive health, but they did other things, including maternal health care and running maternity hospitals in some countries. But once I got on board, I realized more and more, actually, no, the core service is abortion, okay, and family planning, long-term contraception. Okay, I was okay with that for a while, particularly when we were still doing, and my focus was particularly on the clinics, where I felt we aren't providing a comprehensive care pathway for women who are coming in for abortion. But what I realized was that these weren't the women I initially thought of. These weren't women who were, if you like, needing an abortion, okay? These weren't women where their life was at risk, or, that there was something wrong with the baby in the womb, or not even those more difficult cases of rape or incest. Very, very rarely was anything like that, okay? These were what we would know here in Britain. These were social abortions. These were women choosing to have abortion for the usual social reasons, okay? It was the wrong time for a child. They wanted to finish their education. They had no money. They had too many children, whatever it might be, okay? And so that changed it a little bit. But the big change came about halfway through my time. The focus shifted towards how could Marie Stopes support and grow the whole self-managed medical abortion, and in particularly by providing drugs, the abortion pills, through local pharmacies. And that's where it started to shift for me.
Yeah. So how do you go from being, on the senior staff of Marie Stopes International to suddenly not being part of that world and having a worldview sort of change? And how did that happen for you?
Well, I think it was coming to that realization. It took a little bit of time. That the abortion services that we're providing, 80% of what Marie Stopes is doing globally is now over the counter, abortion pills over the counter. And that's just not safe, comprehensive care that they talk about. Okay, women are basically buying these drugs. They're not getting any guidance or help. They're self-administering at home, okay, and left to their own. Nobody's checking things like gestation. Nobody's following up, et cetera, et cetera. And we see that today in Britain. I mean, this is what Pills by Post has actually done to, abortion here, and is doing the same in the US now, okay, in many of the states. And for me, that just wasn't what, what this was all about. And I think also, as a Christian, there was a growing sense that this wasn't something that I wanted to be involved in any longer. And it wasn't, I'm coming near the end of my working career, and I just didn't want this to be the last thing that I did with my my working life, to actually be growing and developing abortion services. I wanted out.
Yeah. And then so you left at that point, and what's happened since then, and where are you going now?
Well, I left, and at one point I wanted just to get out of the whole abortion thing. Okay, I'd had enough, 6 years or more, and I thought maybe I could go and do something else, go back to my business consulting or something like that. Yeah. But a sense that God just wouldn't let that happen. Okay, and a sense that actually, no, I know stuff that I should really be helping to contribute to the pro-life, to the anti-abortion lobby, to organisations like 40 Days or other organisations. And that's what I did. I met with a number of organisations, and where I got an opportunity to do something with my knowledge and expertise was I was asked by Christian Concern to make a comment, to make a witness statement on their behalf about Pills by Post. They took the government to court over the change, the legality of that change, and I was one of their witnesses in that court case. And that got me into looking at, okay, what else can we do? And that led to, we've done a number of pieces of call them research, call them investigations. We've done a mystery shopper investigation where I trained some women to make phone calls to abortion providers, just to see exactly what they're going, how do they manage that call? How do they handle it? What are they telling women? Okay. What's the advice women are getting when they phone for pills by post?
Yeah.
Okay. And this telemedicine that they talk about. Okay. Yeah. Where are the gaps? Okay. Yeah. And just trying to highlight some of those gaps in the safety or the even the legality of some of the things that are being done as a result.
Mm-hmm. And I mean, your knowledge of the sort of abortion as a business and Mary Stopes is absolutely stunning, kind of internationally, and just, the fact that half of their abortions are kind of illegal in other countries, like India, for example. And, many pro-lifers don't think of the international provision of abortion from that perspective. And, you mentioned that like half of abortions in India are like illegal because, they have to be in clinic legally for India. That means pretty much half the total number of abortions are illegal. So that for pro-lifers have no idea about this, and even from a pro-abortion perspective, so-called telemedicine and pills by post, I'm sure many abortion advocates would probably have problems with that, and in that it's not the best kind of care that's possible. So.
Well, I think, Robert, you touch on two things that, for me, if I can just pick up on them, okay? Mm-hmm. Let's deal with the legality of it all. We use India as an example because India is one of the biggest countries in terms of abortion numbers globally, okay? I mean, population-wise as well. Yeah. And for Mary Stopes, it's a large part of the numbers that they're doing, 4.5, maybe 5 million abortions each year. Mm-hmm. And at a time, just over 2 million of those were in India alone, okay? But the 80% of what they do is abortion pills over the counter. And even in a country, the laws in India are quite, quite free. They're a bit like Britain. Okay, you can have abortion up to 12 weeks. You need a doctor, to sign off on it, and it's legal in a clinic. Okay, but it's illegal to buy the abortion pills or to sell the abortion pills in a pharmacy without prescription. But that's what's happening. Yeah. So that was part of it. It wasn't that, Mary Stopes is talking about harm reduction, and it's talking about caring for women, and it's talking about women's rights, okay, and reproductive rights in particular, and choice being a big thing, okay. Yeah. But actually, in these countries where they're going, the large part of what they do, the abortion pills in the pharmacies, isn't legal. Okay, never mind, it's not good, safe abortion care. Okay, so whatever you think of abortion, those two things, it's not safe, comprehensive abortion care. And in the countries in which it operates, you said India, it's not legal. That's half of their production, okay, half of their numbers. But it's not legal across most of Africa either. In fact, I don't really know any country where Mary Stopes operates where procurement of buying the abortion pill over the counter without prescription is legal.
So basically, we've got a situation where the British government are funding, an international abortion provider, one of the biggest in the world, funding an abortion provider to go into other countries and break their laws, and this is paid for by the British taxpayer, and it's happening on a colossal scale to the extent that 50% of what Mary Stopes are doing abroad is illegal according to those countries. I mean, it's quite hard to believe, but that's basically what's happening.
Well, let me say, I mean, just on that to clarify, I mean, it's probably much more than 50%, but let's leave it at 50%, okay, being illegal. Of course, the British government does not fund Mary Stopes to do illegal services. Yeah. Okay. Mm. They provide money, like in the WISH program, so the Women's Integrated Sexual Reproductive Health Services, and in particularly for family planning. Okay. Yeah. But they also provide money, for example, in the West Africa situation for WISH, they provide money for post-abortion care. So these are women who have already tried to have an abortion by some other means, and they end up in a Mary Stopes clinic needing maybe they still have retained products or whatever, and they need some help. That's what Mary Stopes reports. Mm-hmm. And what they report is all the abortions we do in this country are post-abortion care. We don't do induced abortion on demand.
I mean, from say somebody is not pro-life and they're from a pro-abortion perspective, and they, we've got all the kind of safe abortion and the mentality that you're mentioning, but the reality of what we're talking about in terms of the reality of what we're talking about of sort of pills by post, telemedicine, this isn't the same thing as the pro-abortion rhetoric. There's a complete disconnect there, and do you think there are people who are either in favour of abortion or abortion workers who seeing that reality of pills by post, what this actually entails in some of these other countries, the narrative kind of breaks down at some point? Do you think does that kind of make sense as a question of just like at what point does the narrative break down when the reality of abortion provision is faced with kind of the sort of the thinking and the safe abortion, etc., versus pills by post?
Okay. I mean, those are good questions. I mean, pills by post is much grander than what we're talking about in Africa or South Asia, where it's just over the counter without the guidance. Whatever the guidance isn't that great anyway in in the UK, but there's none of that overseas. So I think I'll take two aspects of that. One is, look, when Mary Stopes or Planned Parenthood or the likes, IPAS or whoever, are developing their strategies, they know that when women take the pills across the counter in pharmacies, they know that there will be adverse events, that there will be women needing to go and get help afterwards, okay? We can almost predict the number of those women, okay?
Yeah.
But because they take this harm reduction approach, their view, I mean, this is what we talked about. They're saying, well, it's better than a sharp stick. So they'll take the pills, and some women will suffer as a result and may need to go to hospital to have further care and treatment to put things right. But it's better than a sharp stick. Now, towards the end of my time, I was meeting, obviously, with clinic managers, clinic workers, and what I was hearing from them was, look, we're seeing more and more women coming into our clinics now with PAC. We're doing many, many more PAC.
Yeah.
And I said, look, you don't need to use the word PAC with me. I know, post-abortion care. I know what it is we're doing, okay? And they said, no. PAC. And I said, well, do you genuinely mean post-abortion care? And they said, yeah, we're seeing lots more women coming in with retained products, still bleeding, hemorrhaging, whatever, and needing assistance. And I've asked them, well, why? What's going on? And they've said, well, actually, it's because they're starting with the pills from the pharmacies. And they take the pills, and the pills are not working. And so they're coming to our clinics to be treated because the pills that they bought in the pharmacies are not working. So even our clinic workers at the time in Mary Stopes were saying these abortion pills are resulting in many more women than we've seen before coming to clinic needing PAC, post-abortion care. Whose drugs? It's Mary Stopes branded drugs, or it's DKT branded drugs. These are the organisations that you talked about a moment ago that the British government is funding to do other things, and that funding is helping to support this sort of work.
What we're really talking about is...
I just go to this is great. It's very natural in conversation.
Try to avoid it.
Yeah, because I think you could. Then we've just got solo Kevin's track. But you're doing great, Rob. It's a great.
So don't do that.
Yeah, look, lots of people do it. It's a natural thing to do.
But don't do it.
Yeah, I think it's helpful not to do it.
So
you haven't been doing it. You get
So we're really talking about a situation where we're really talking about a situation where we kind of like lost touch with reality. We've got people's understanding of what happens with abortion in Africa, and then we've got the reality of what you just described, with pharmacy pills and then coming in for sort of botched abortions. And for Westerners, it's like, this is what we think abortion looks in Africa, and then we've got the reality of what really happens, and these are two completely different realities. Is that a fair statement to make?
I think it's absolutely fair, Robert. I think we and that's why I got involved to start with. I thought we were helping women, women who, through no fault of their own, were being hurt and actually near death with the needing for abortion. But that's not what it is. And actually, the abortion organisations are causing as much harm as they're talking about preventing.
Yeah.
Okay.
And so, I mean, we're coming on to the kind of last bit of your story. Like, we've had this so-called telemedicine in the UK, and you've been helping with a campaign on that. And what's the next steps for you? And we've had this sort of response to with coronavirus, so now having abortions at home in the UK, no kind of all restrictions lifted. What's this sort of stage after leaving Mary Stopes? It's a remarkable journey that you've been on, and what's the last part of the journey?
Who knows? Okay, I mean, so it's evolving, and we're on this road. But I think that at the moment, the abortion activists want abortion in the UK to be decriminalised, to basically be free of any medical constraints or any constraints at all, just on demand, without question. And in a sense, that's what they've now got. Okay, with telemedicine in particular, a woman just needs to make a phone call. She can give any reason she wants, no reason at all, and she gets the pills and she can have her abortion. Okay. One of the aspects that I think it is important for us to push on, and it's the thing that we've just been doing recently, is helping people to see, look, the data that get presented by the abortion providers or by in Parliament itself, okay, by the Department of Health and Social Care, when they say, look, the numbers of women who need help or the side effects are quite small, those numbers are, they're not the full picture. And so we did this Freedom of Information investigation where we asked hospitals, so how many women are you seeing coming into your hospital needing surgical attention as a result of taking the abortion pills at home? And we got this big number that's not being reported by the government or by the abortion providers. And that's what we want to try and fix at this point in time. So look, if we're going to do this, let's do it eyes open and let's be truthful about the numbers and the data. Okay, because maybe in England and Wales, actually, just alone, there might be as many as 500 women a month attending hospital as a result of taking pills at home.
Well, we've had this situation where both like Margaret Sanger and Mary Stopes are sort of kind of disassociating themselves with Margaret Sanger the person, and just like, oh yeah, she was kind of a eugenicist and racist and what have you. I mean, you think we need to have that kind of awakening of what sort of abortion at home really entail as well, and waking up to just this new reality. It's really interesting to see both Planned Parenthood and Mary Stopes kind of disassociate themselves a little bit with their founders. Really fascinating perspective.
It is. I think that's, having been the insider, I wasn't particularly aware of, we didn't talk about Mary Stopes as a eugenicist or anything like that, okay? And the race element never really came into it.
Sure.
But we wanted, Simon Cook has clearly wanted to distance himself from the Mary Stopes legacy. Planned Parenthood are just in the last few weeks doing the same thing, okay? But actually, really what we need to be saying and targeting now is, well, how do they distance themselves from the reality of what they actually do today, not 1920s, but actually what are they doing today across the globe, okay? And how would they distance themselves from that? Okay.
Yeah. Well, I mean, your inside sort of knowledge is stunning, and just the perspective that you have in terms of 40 Days for Life. How did you see 40 Days for Life when you were working for Mary Stopes, and you're seeing from the other side of the fence, kind of these crazy people outside some of the clinics. What's your perspective of peaceful prayer vigils outside abortion centres, and what does 40 Days for Life look like from Mary Stopes' perspective as a former worker?
Yeah, that's very interesting. We used to have a saying, I think people still use it as an excuse when I was at school, the dog ate my homework, okay? And I had an excuse for not turning in my homework or whatever. And this occurred when I was directing the guys who managed the clinics in Africa and South Asia and Mexico and other places. And they would say, our numbers are down. Why are they down? Oh, those guys are outside the clinic praying again, that 40 days thing. And so 40 days was something, it was an excuse used by my team for their poor numbers. The attendance was down, The delivery, the service numbers were down. Okay, the abortion numbers were down. And in fact, ending up sometimes having to close clinics for a period of time because of the vigil, the chaos that was being, surrounding that. And I know we shut clinics in Mexico and South Africa and Kenya, Uganda, whatever, because of 40 days. But the thing that did surprise me when I was working there and responsible for all of this was, that's okay. I mean, I know the background, it's Lent, isn't it? Okay, it's Easter time, fine, okay. But I'm sitting with these people in October thinking, and looking at their numbers, and they're saying to me, oh, the numbers are going to be down again. Why? And they said, oh, it's 40 days. And I'm thinking, no, it's not 40 days anymore. That was Lent. And they said, no, they're back again. They're doing it again. Okay, so it's not just a Lent thing. Okay. So clearly we were aware. Okay. And in some countries, in some cities, we closed clinics, or it was definitely affecting the numbers of women that would come to our clinics. But more than that, it actually causes stigma. And I think that's a good thing. It normalizes the stigma, okay? Mm-hmm. Because I think it's important for 40 days to be there, to actually have that alternative voice, okay? Mm-hmm. To actually, for the women coming in and the women going past, okay, to see, look, there is another alternative, okay? And it's, abortion's not always okay. It may not ever be okay, but there's an alternative. There are options, and you need, the opportunity to talk to other people. You need to consider the reality of the baby growing inside you, okay? Mm-hmm. Like I saw your signs recently for America, ask to see the ultrasound or look at the ultrasound, and that would be great, okay? Just that awareness is good, okay? But not just makes it, that awareness for the women who might be abortion-minded coming to a clinic, but it does impact the staff working in clinics, okay? Mm-hmm.
Yeah.
And it does prick their conscience. And they're not always happy doing what they're doing, okay? Yeah. And sometimes, I've talked to many, many nurses in Africa and South Asia and so on, who joined Mary Stopes because they thought they would be helping women. And particularly they thought family planning would be a good thing to be doing, okay? And then they get in the organisation and they realise, well, family planning, yeah, we do that, but it's a bit of a side thing. And the main thing we do is abortion on demand, okay? Mm-hmm. And that's not what I signed up for. And I can't talk about it with my family. If they knew what I was doing, they would be against it. Mm-hmm. I can't go to church and talk about it there because they would think I was doing the wrong thing. And I don't know what to do with it all. And now people are praying outside the clinic every day I come to work, and it's getting to me. Okay, mm-hmm. It's pricking my conscience. So I think it's a good thing. We're the clinic workers and the clinic managers are definitely aware, and it's definitely having an impact.
Wow. And this is absolutely fascinating because, Africa's largely sort of uncharted sort of waters in terms of pro-life activism, and you're an expert in this particular field. And there's so much, there's so much good to be done so much good to be done for pro-life activism, especially in developing countries. America, pro-life movement, highly developed, but in some of these countries, things are extremely undeveloped, from sort of a pro-life activist perspective. And so the campaign that you're describing is, the sky's the limit, what you can achieve in nationwide campaigns. You're looking at, because 80 to 90% of people are pro-life in many African countries. Yeah. So there's this huge campaign waiting to happen, and you're an expert in this field. Exactly, and not only that, there's this enormous disconnect between Western countries funding abortion in these countries and what really is going on there. There's a complete disconnect, and then there's nobody working in the field of pro-life activism to expose that chasm between the two. So, what would you say to somebody who was interested in being a 40 Days for Life leader? Maybe in Africa or some of the countries where you're working with Mary Stopes. What would you say to somebody who wants to do something about abortion? Is a prospective sort of pro-life leader?
Yeah, I think there's a couple of good points there. For a moment, when you were talking about how weak the pro-life movement might be in some of these countries. I thought you were talking about Britain compared to the US because,
well, Britain too, yeah.
because actually we are still,
still behind, 10 years behind, 10 years
and
behind,
lots of scope for development here as well.
Exactly.
Huge scope.
Yeah.
I think if you're contemplating, go back to this thing of the 70-80% thing, okay? Because I was talking with you about this. I've talked with Uju about this and other people, and I've seen it in my time of travel there. There is a predominance of pro-life, anti-abortion, pro the baby, and the wonder of the baby growing inside the womb and all that, much more than the other side. Okay, but if you listen to the rhetoric, if you listen to what the organisations like Mary Stopes tell, even in their talking to the UN, and they're talking to the UK government or the US government, okay, they put across this completely different picture, okay. The African women need abortion, okay. The African women need to have smaller families. They need to have family planning. They need contraception, okay, and they certainly need abortion. And so the funding is not just for the provision of services, but they use the funding to build that rhetoric, to actually get inside government in these countries to try and change the legislation. And that's where I think 40 Days and others can help in Nairobi, across, Africa, in Nigeria, is to actually just call out that lie.
Yeah.
Okay. And in some way, I know we've talked about this before, 40 Days very much pro-life for normal people.
That's right, yeah.
And it is about giving people permission to be pro-life, to be, have permission to actually stand up and say abortion is wrong. That there are, not all women need abortion. Abortion's not hardly ever necessary, okay? And it's okay to stand there and say it's wrong and women should not be doing it, okay? And you should not be coming into our country talking about it and trying to convince our government to make it a legal thing here, okay? That somehow we need to give people permission to say that, because if you don't, the other side have been very good at stigmatizing it. And if I stand up and say something against abortion, then all of a sudden I'm anti-woman, okay? And I'm this, particularly as a male, I'm anti-woman and I'm preventing women getting necessary health care or preventing them making good choices or whatever, okay? And I need to have permission and support to actually say, no, actually you're wrong, okay? And actually there is a different story to be listened to here.
It's almost as if giving permission to the pro-lifers in some of these countries to call this out and to speak about the reality, to normalise pro-life thinking in many of the countries. And this is the start. Our phrase is the beginning of the end of abortion with 40 Days for Life. And yeah, I mean, just thinking of the size, we've now got campaigns in every single Latin American country. The sky's the limit with what's possible with Africa, with India. There's like over 1 billion people in India, and just the size and scope of what's possible for the pro-life movement in these countries. We've got this sort of woke sort ofness at the moment, and what Uju says about neocolonialism of importing Western notions of abortion into Africa, for example, just calling that out is like a first step. And actually when people do that, we see Mary Stopes close in Nairobi temporarily. Just so much can happen, like the entire seismic shift can happen very quickly and very easily. And if 70, 80, 90% of the population is pro-life in some of these countries, then it's very easy to see quite a quick shift when you empower the local communities to say, well, actually this isn't okay, this is what's happening, this is the reality of the story. So I mean, that's a huge campaign in and of itself, and your journey is absolutely fascinating in terms of where you've been, the expertise, the knowledge that you have versus kind of what comes next. So I mean, it's
let me just add something to this, because in my experience looking at things, from outside, as it were, and now in the last couple of years, I see 40 Days as a little bit different from some other organisations that might do this. And I think that's part of the answer as well. I think that if you're thinking about being a member of a team or helping to lead a team in one of these cities across Africa or South Asia or wherever, then I would encourage you to do that. And I think 40 days helps you to find a way to speak about abortion with those two things that we talk about, the truth and the love. Okay, that it's important to talk truthfully about what abortion is, and the result that it is killing the baby, and that it is harming the women, and that there are other choices and options. But to do that in a way that is loving and supportive of women who are abortion minded, or actually risking raising the subject in a discussion where we might trigger women who have had an abortion. Okay, because every one of us will know somebody who's had an abortion. We might not know they've had an abortion, okay, but we will know people who have had an abortion, okay. And sometimes it's difficult just to have that conversation. And I think that's what I mean by normalizing. We need to find a way to normalize this so that we can get back to talking about abortion, so that it's not a dirty subject, that we want to keep away, hidden behind the scenes somewhere, but that we can talk about it, and that we can talk about it in a way that is both truthful and honouring to God, and yet loving and supportive, as I think he would want to.
That's absolutely brilliant. Yeah, and how can we talk about abortion in a grace-filled way?
Yes.
Truth and love, charity and truth, mercy and justice, kind of at the same time. And just in the UK, we mentioned kind of being 10 years behind America. How would you see like the pro-life movement developing here in the UK? And you've just been around for just a few years, couple of years at the moment. But how would you see things developing like in the next 5-10 years?
I'm very much a newbie, as it were. Okay, I took a year to consider what I should be doing and so on, and didn't do very much. So I've only really been doing a pro-life, anti-abortion thing for about a year, not much more than a year now. Okay. I think there's huge scope. Clearly the law might be against us in terms of buffer zones and where that goes. Okay, but in the meantime, there's something like 130 different places where BPAS and Mary Stopes operate across the UK, operate across Britain in particular. And, we don't have vigils outside all of those places.
Exactly.
Okay. And some of those places are quite interesting because it's not all where, for example, BPAS owns the building and they're the only people in it. And actually, I think it's quite effective to protest. You are protesting, but to hold your peaceful, prayerful vigils, okay, outside a place where Mary Stopes is sharing space.
Yeah. It's going to be awkward.
Because it may be awkward to do it, okay, but it really causes an issue for the landlord and for BPAS when it comes to talking about renewing their contract. Because other people in that building don't want it. They don't like it, okay. But it's part of their business model now. So these, they refer to them, I think, as early medical units, okay, where it's just nurse-led and it's maybe one or two people. They may only be there a few days, a few afternoons, whatever, per week, okay. It's a way of getting reach and being more available locally. But it's shared space. And, vigils outside those sorts of places could be just as powerful as outside one of the big, like in Brighton recently, one of the big BPAS centres or whatever. Yes,
that's right. Well, any closing comments for our listeners today? It's been really interesting talking today of, your personal journey and then abortion in Africa. This huge topic, and the sky's the limit for the future. What the next steps for you are, and what next?
I think that the key thing for me is learning that it's okay to, let me step back a little bit. For 6 years, I avoided telling people what I was doing for a living. I used euphemisms around that I was helping in maternal health care. I was doing consulting overseas. I was, if I got into any of it at all, I would say family planning, but I would rarely, if ever, mention the abortion word, okay? And then I got out, and then I realized actually talking about being anti-abortion also has stigma. And sometimes when you say to people, look, I'm actually working with that organization that is taking the government to court over abortion law, or I'm working with people who have vigils outside clinics, people look at you as if you're some sort of, weirdo, or you're some religious nut, or maybe, why are you doing that? Why are you getting in the way of women accessing their right to essential health care? And I think, just can we get to a place where it's okay to talk about those things, and it's okay to hold this position? I don't think abortion's right, okay? And I think it's okay to talk to women about other options and to make sure that they're fully aware of all of their options, okay? And I think it's okay to call out BPAS and Mary Stopes for their less than professional ways of doing some of these things, okay? And I think it's okay to call out the government and others when they are not using all of the numbers and all of the data. And let's get the story out there. It's okay to talk about that, right? And I'm not anti-woman. I'm not standing in the way of women making choice, okay? But I want it to be an open, honest, fact-filled discussion, mixed with, for those women themselves, mixed with the things you said, Robert.
Yeah.
The love and the support and the acceptance and all the rest of it.
Well, it's been fascinating speaking with you today, Kevin, and I really hope that God blesses the next steps in your journey. And it's amazing to hear your past, and also to hear how 40 Days for Life is from a sort of former worker's perspective, and also positive message for our supporters and followers as well. So I'm just going to speak to the camera for a second. So it's been wonderful and amazing speaking with Kevin Duffy, former worker for a senior executive with Mary Stopes International, now MSI Choices. Kevin has shared his fascinating story of how he used to work for Mary Stopes in Africa, but also a powerful and inspiring message for our local leaders, and a perspective of what 40 Days for Life is like from working for Mary Stopes, and a message of encouragement for how your prayers are impacting it's saving lives in other countries. We're seeing abortion centres temporarily close, and the sky's the limit. We want you to help not only spread 40 Days for Life all around the world. This is doing God's work in taking a message of prayer, truth and love, truth about abortion, and love to women who are in a crisis pregnancy. This is how God is working in our campaign. We're seeing lives saved, we're seeing hearts and minds inspired, we're seeing pro-life for normal people, we're seeing the pro-life message shared in different places. And there's so many ways that God can help, that God can work in the pro-life movement, and we are ending abortion one person at a time. So join us and help spread 40 Days for Life internationally. Thank you so very much for watching today. May God bless you.